Let's speak more on this now. We are now joined by the Deputy Minister of Health, Dr. Joe Phaahla. A very good afternoon to you, Deputy Minister. So the latest updates, from UNAIDS, what we're hearing is in the main a positive one for South Africa, in making great strides in halting the spread of AIDS, we're told. But that said, Dr. Phaahla, is the target of ending AIDS as a public health threat by 2030, that's in 6 years' time, achievable?
Well, good afternoon. I hope I'm audible. I'm in a bit of an area where there's a bit of noise, but I hope I'm audible.
You are.
We, as you have already said, together with all the nations of the world, under the United Nations and led by UNAIDS, by our executive director, who Ma'am Sophie spoke to earlier on. Indeed, we are very committed to the target of making sure that by 2030, we can make sure that HIV and AIDS are defeated as public health threats. By so doing, it's not suggested that we are hoping that by 2030, there will be no HIV at all. But what is expected is that it will be completely under control. In other words, we are aiming to reach a stage where by 2030, everybody would know their status. Everybody would test and know the status, and everyone who is positive for HIV will then be on treatment, and everybody who is on treatment will be virally suppressed, and also that we will achieve also the target of making sure that the target of making sure that young people are HIV free. In other words, there should be no new infections. Those are the aims which we are working on, and we believe that it is possible.
The strides are commendable. I will agree with you on that. But, you talked a little bit about new infections, and I want us to just touch on, the problematic areas. There are, of course, concerns that whilst HIV infections amongst children in eastern and southern parts of Africa fell, I think, over 70%, between 2010, 2023. But the fall has slowed in mother-to-child transmission, as well as the numbers are still very high when it comes to children living with HIV under 15. Dr. Phaahla, I hope you can still hear me. What are we doing, and what are the drivers
I can hear you.
in as far as those concerns are concerned?
Well, before even the formal opening of the conference this morning, we had a session which was very well attended, which was actually the aim of it is to bring an end to HIV infection in children. In our case, that program is also led by our second lady, the wife of our deputy president. I was really encouraged by the nature to which this pre-conference satellite event was so well attended, almost looking like a plenary in itself. So it's an area which, for all intents and purposes, should be achievable, because unlike the adult population, when you talk about children, we're still very low worldwide in terms of making sure that children who are positive are tested and put on treatment. The numbers are not huge, but it's the coverage which is a problem. And one of the speakers actually said part of the problem is that we have not put so much emphasis on working on relying on mothers, on women, because all those children who have not been found have got mothers. So those are some of the things some of the issues which we'll be looking at. We believe that is achievable. We should be able. I think the more difficult actually is the issue of stopping new infections, especially amongst young people and especially amongst young girls and adolescent women. So those are the issues but in this conference, both from social mobilization, but also from a biomedical in terms of various preventative therapeutics including injectables. So there are a lot of new initiatives which will be reported at this conference, which hopefully will help the ammunition in taking us forward to eliminate HIV as a public health threat.
Yeah, and I agree, Minister. I don't think it should be something that we're still dealing with, considering, of course, that HIV, should be front and center of general healthcare, especially because we're talking about very young children here. And as you say, there's so much treatment. But let's continue then and perhaps talk about, what avenues and challenges are experienced in those services in general healthcare. I mean, we know that the integration of services, especially HIV, is important in general healthcare. But when it does come to HIV, to what extent, has this then been hampered by the growing funding shortfall that we are hearing of in the healthcare sector, as well as a lack of adequate resourcing and political will, if I can call it that?
Well, maybe just starting with the first one, the issue of political will. I would, starting with our own country, but also as we share experiences with other activists, leaders of government, leaders of civil society, professionals, we can say that, just from our own experience, that the fight against HIV and AIDS is actually, the commitment is at the highest level of government. You would remember that all our South African National AIDS Councils are chaired by the Deputy President of the country. So as we speak now, our current president was at some stage, when he was Deputy President, the chairperson of the South African National AIDS Council. He remains committed and working with the Deputy President. We've got an interministerial committee of cabinet, which is also pulling together all of government, and then all of society as well under SANAC. We've got civil society, got government. We have recently brought in the private sector. So and within the civil society, we've got trade unions and everybody, and at the provincial levels, we are making sure that where in some provinces things may not be moving so as quick as we would want at district level as well. So there is commitment at the political level. Now, in terms of resources, we are one of the countries which all our partners, that is PEPFAR, the Global Fund, UNAIDS, keep on encouraging us to say, you are one of the few countries which have put your own national budget into the fight against HIV. There are still some countries which depend mainly on donors. So we are urging the donors not to drop the ball at this stage. But at the level of government, if we use South Africa as an example, we remain very committed. I know that there has been some concern in the last year when there was cost cutting, when there was some funds shifted. But this was compensated by the fact that the health department, in terms of procuring the necessary goods in terms of medicines and testing and all that, have actually been able to negotiate lower prices. So that was compensated. But we're urging our partners within government, the Treasury, to make sure that going forward, we cannot afford any further budget reductions. And we have a commitment, I believe, even at this meeting, that commitment will be made from the partners, the big ones such as PEPFAR and also the Global Fund.
Dr. Phaahla, thank you so much for your time. Let's leave it there for now. Of course, Dr. Joe Phaahla is the Deputy Minister of Health in the country. Of course, that conversation coming as the International AIDS Conference gets underway in Germany today.